We're here with Dr. Bruce Schneider and Acadiana Oral and Facial Surgery to ask him some questions about Botox and fillers. Tell me all the little dirty secrets. When women walk in here, do they have an idea in their mind like, I only want to have fillers done?
Actually, very often when patients come in, they're requesting either Botox or they're requesting a filler. They don't actually understand the difference between the two. So often we have to educate them on what fillers will do and what Botox will do. What they don't understand is Botox works on muscle movement. It'll only work on dynamic wrinkles, and these are wrinkles caused by creasing of the skin, bending of the skin because of the muscle pull. So when we stop those, the only way to stop that is actually to stop the muscle movement. So wrinkles in the forehead, between the eyes, these are all creases caused by bending the skin. Much like when you wrinkle up a shirt, you know, you can hang it in your closet, and a few months later, if you've never wear it, it looks a lot better because the wrinkles have disappeared. Well, that's what we do with Botox. We actually stop the muscle movement, we stop the bending of the skin, and those wrinkles eventually will flatten out.
So you prefer to start with Botox if they've got that dynamic wrinkle?
If it's a dynamic wrinkle, Botox is the only thing that will work for that, yes.
So if they come in and they only want fillers and they had a budget and they're telling you that, will you suggest and say, you know what, we really have to do the Botox first and maybe?
Again, it depends on what they're pointing to. If they're pointing to wrinkles here, what's called the nasolabial folds, that is something that a filler will fix. Botox will not fix that, and that's a common thing we get too. I want Botox for this. It doesn't work for that. So fillers for this area, Botox for every, where they move. Wrinkles caused by movement, those are the ones that Botox works on.
So you're educating them in a sense. I mean, they come in here and they're really not educated as to what they want sometimes.
Exactly. And a lot of times what I will do is I will talk to a patient, show them their options. And, I don't want them to jump into a treatment. I will have them come back a week later and then, they can tell me what they want now that they've sort of been able to sort of digest and grasp.
I see so many women that are not used to having their face changed. And then all of a sudden it looks better, but they're just not used to it.
Right, they don't look like, and you want to make sure they look like themselves. So I actually like to see, even with something like Restylane, and if we're going to use it for fillers or in the face as compared to Botox. Botox not so much, but with fillers we want to see photographs of them before, maybe 5 years ago, 10 years ago, and kind of get an idea of what they look like. So now we can see where the volume has been lost. That's what we're using the fillers for, is lost volume.
And what's the importance of photographs? I know you mentioned when we were talking earlier about photographs versus a mirror image.
You look at yourself in the mirror every day, your brain gets rid of those little fine lines that you have and finer, small imperfections as well. And then it makes yourself look better. It sees what you feel like, not actually how you see yourself. Well, when you take a photograph, now when you look at a photograph, your right side is across and your left side is over here, and your brain can't fix it. It can't get rid of those minor imperfections, and then you see yourself as you really are, not as you want to be seen.
I think that's so interesting.
So we always make sure patients assess themselves with photographs and not in the mirror. And we'll have patients, if you look yourself in the mirror, look at yourself in the mirror only, and then you have a minor treatment done, you might not even notice the difference. But if you look at a photograph before and then look at the photograph after, then they see a big difference.
And I've seen that a lot I used to do makeup. And I used to do women's lips and eyebrows, and every now and then a woman will go, she'd just freak out about her eyebrows. Okay, guess what? The good news is we can wipe it right off. And I would think, what do plastic surgeons do, or people in this business, when they actually do create that change that might last like 6 months?
Well, with certain fillers like Restylane or even Juvederm, being its hyaluronic acid, again, we can add an enzyme to reverse that. And that's one of the reasons I like using these types of fillers. Again, I would never recommend someone using any type of permanent filler the first time. I will not even offer any type of permanent filler on anybody unless I have treated them several times and they know exactly what they want and they're getting the consistent look that they want.
And the face changes with age anyway, so some of those changes you make has to be flexible.
I actually find that fillers work better on someone younger because we don't have to use as much volume to get them back where they were before.
Do you think it's preventative? I think it's preventative.
I think
feel
it's very
like we have a
preventative.
new generation that is understanding they don't want to do the real hardcore surgeries maybe, so they start doing it a little more younger and they look better farther out. And I actually once read that a plastic surgeon said, we like to get them and do their eyes at 40 and above and start doing little procedures as opposed to waiting till all the elastin in the skin just drops.
I agree, 100%. You see a lot of celebrities included that have had facelifts done and now they no longer look like they used to look. Well, that's because they tried to adjust it all with tightening instead of volume. So it's a lot of combination.
And it's sad when you have to do 3 facelifts to look good. I mean, I think there's a limit, and I think people don't need to go over the top so much. And unfortunately, we are living in an era where it seems to be like it's over the top, the pillow lips, the overblown look. I just think we need to go back to being who we are, but better. You know,
when I assess a patient and they ask me, what would my facelift look like? There's a lot of technology that you can look and actually you can adjust it and you can do it on the computer. I think it's a very simple way is I have them lay on their back with a mirror. And this is a relaxed look. This is what your facelift will look like.
Yeah, that's great. Well, we really appreciated this. And it was very enlightening. We were very happy to be here with Dr. Bruce to get his tips and tricks on what will keep you forever younger.